Hello and welcome to Dragon Bytes, the pediatric podcast aimed at pediatric trainees or anyone interested in child health. I'm Asim, one of the pediatric trainees here in Wales and one of your hosts for Dragon Bytes. This week we're joined by Dr Maddi Adams. She's one of the oncology consultants based in the University Hospital of Wales. She's going to discuss applying for and interviewing for the Oncology Grid programme with one of our newest hosts for Dragon Bytes, Celyn Kenny, who you might remember from our episode about health promotion for S4C, the Welsh language channel. So if you're considering a career in oncology, or if you've already decided on it and you're applying this year or next year, give this one a listen. So let's get started.
Hello and welcome to another one of our Career Grid Dragon Bytes podcast. You joining me today is Celyn Kenny. Hope you're all still understanding my very strong Welsh accent and haven't switched off yet. So today we're talking about oncology. And I've been fortunate for the last 6 months. I've been working on the oncology ward in the University Hospital of Wales in Cardiff. And I'm joined today by one of the consultants that I've been working with. So I'd like to welcome Maddi Adams.
Hello.
So we'll just start, Maddi, if you could just introduce yourself and tell us where you work. Obviously, I've spoiled the surprise there slightly. And then we'll get going with the podcast.
Yeah, thank you very much. So I'm Maddi Adams. I'm consultant paediatric oncologist at the Children's Hospital for Wales, and I've been working here as a consultant now for just over 2 years, and it's my first consultant job.
So why did you choose paediatric oncology?
So basically, I've always found the whole sort of science behind cancer, and I particularly when I was in medical school really enjoyed haematology and found the sort of lectures and things really interesting. But then when I was an SHO in paediatrics, I was given a 6-month post in paediatric oncology, and it was then really that I realised that it was a specialty for me. I really enjoyed the clinical side. I think it's a specialty where you can kind of make a real difference to both the patients and their families, and also I enjoyed the fact that it's very research based and that you are treating patients constantly in clinical trials, so you're constantly improving things all the time for families. And so and also when you compare it to the haematology training pathway, it's relatively more straightforward to do paediatric oncology because you stay within the paediatric training and don't have to do the kind of adult side which you have to do for haematology. So I found that more appealing.
And how long ago did you complete your training?
It was 3 years ago now, I think. Yeah, it's hard to remember. Yeah, about 3 years ago, because I did a locum post for a year before I did a consultant post. So yeah.
And that was all here in Cardiff?
And well, partly, so my grid training was split between here and Bristol. So I did 18 months in Bristol, and then did my final 12 months in Cardiff.
Lovely. What about the training programme? What did it involve?
For paediatric oncology?
Yeah.
I initially applied for grid training in ST4, but I wasn't successful the first time round. And then I took some time out of programme and did some research, and then applied again at ST5. And essentially, the grid programme can either be for your final 2 or 3 years of training, depending on at what point you enter it. And you have to do posts in solid tumour oncology, including brain tumours, haematology, and bone marrow transplant. So if you go to a centre where they don't have a transplant unit, then they're usually coupled with a centre that do, so that you spend 6 months post doing transplant as well.
So how long in total is the oncology grid? Because we learned from neuro there's a slightly longer, because they actually have to cross into the adult world. Oncology is different?
Yeah, it's different. I think the minimum is 2 years and the longest is 3 years, and it depends at what point you enter the training. So if you end up if you do a 3-year grid post, then they do recommend that you usually do 6 months of a kind of allied specialty. So you would do the 2 years within oncology, and then the transplant and haematology. And then, for example, they might suggest that you do 6 months of neuro, because obviously we work closely with them from the brain tumour side, and also, or maybe PICU or something like that, as a kind of, so you wouldn't spend the whole 3 years necessarily in oncology, but it is still part of the same grid program. I did a 2-year, so mine was 2 years. So I did, well, it was actually ended up being 2.5 years, but that was because of being slightly part-time after having kids.
That's good to know that you can do it part-time.
Yeah, so I did 80%, so I used to work 4 days. So I did, my first 18 months in Bristol was full-time, and then my final year was 80% in Cardiff. And then I ended up doing 3 months of palliative care at the end, just while waiting for consultant post.
So that actually leads quite nicely into the next question. What posts did you do in total in that time?
So within the 18 months in Bristol, I did 6 months in solid tumour oncology, 6 months in haematology, and that's mostly malignant haematology, but there is some of the benign haematology stuff as well. And then I did 6 months in transplant. Then I was on maternity leave. Then I came to Cardiff, and then in Cardiff it's not so split like that. So I was within pediatric oncology, and that finished off my training. And then I applied for a kind of standalone palliative care post, which was meant to be for 6 months, but I'd only did it for 3 months because then I got a consultant job.
It's worth finishing it early for that. And what are the specific requirements you have to achieve by the end of training?
So there's within the kind of e-portfolio and the RCPCH curriculum, there's some specific competencies that are specific to paediatric oncology, haematology and transplant. So you kind of have to demonstrate all that in the e-portfolio. You obviously have to have all of your competencies from your training up until that point. So the level 1, level 2, and all of the child protection and all the sort of APLS and all those sort of mandatory things. And then you have within your grid training, you have your ARCPs obviously within your deanery, but then you also have an annual grid assessment, and that's a bit like the interview, but essentially we always used to go to London for it, and they assess you by, basically there's a panel and you go in and they give you a few clinical scenarios, then you have to critically appraise a paper that they give you, and also then they just ask you how everything's going, a bit like an ARCP. And so you have to pass both of those components to kind of progress each year. Yeah. And then you do start the same as everybody else. And then
it's quite intense that having an interview every year.
Yeah, it's not so bad actually, because I think once you've done it the first time, you know what it's going to be like. It's the same every year. It's always the same: 2 clinical scenarios, 1 critical appraisal of a paper, and then
so you know what to expect.
Chat, and they really drill into how to critically appraise papers. So it's quite, once you've done it a few times, it's quite straightforward.
That's okay.
And they don't give you really hard ones. They're usually either really good or terrible.
So it makes it a bit easier for you.
Yeah.
And is it a nice social, being able to see people, or is it?
It's quite good because there'll obviously be other grid trainees there at the same time, and so you do get to find out how people are doing around the country. And there's also within the paediatric oncology network, there's a paediatric oncology trainees group that is basically a group that's set up by there's grid trainees, but there's also non-grid trainees in it who have an interest in oncology. They may want to do shared care, or they might just be thinking about applying for the grid. And I joined it when I was an SHO, and they have meetings. It used to be they had meetings every 6 months and it would be a grid trainee in each hospital would organise it. So I organised one in Cardiff quite a long time ago now, 2011 I think it was. And then you go there, usually it's for a weekend, and the local consultants will give lectures on various, whatever their expert thing is. But then that's quite a good kind of networking, and because it's quite a small field, and these people are going to be your colleagues when you get to be consultants. And so we always ask each other for advice about various patients, because different obviously consultants around the country have different expertise. So it's good to know who people are, and it's also good just to kind of just find out what the opportunities are really in other hospitals and things as well, isn't it? So
and learn from each other, I guess.
Yeah.
So what general advice would you offer trainees who are thinking about or are in the process of applying for paediatric oncology?
Yeah, so I think if you are interested in oncology, it's good if possible, and I know it's always difficult with the whole how the training pathways are, but if you do recognise it fairly early on, then to make contact with the local, your local paediatric oncology or haematology department, and just basically get some advice, because there's lots of things you can do before you get to the point of applying to kind of strengthen your application, because when you're applying for oncology, it's the same, I'm sure, with all the grid specialties. They want to see that you've demonstrated an interest, and so it may be that and most consultants have got various projects ongoing that they would always be very happy to have some help with. So it would always be useful, I think, to approach people, tell them you're interested, try and attend some clinics, maybe do some taster days or weeks, whatever you can do as part of your deanery, see whether you really like it. Some deaneries are flexible, and if you asked for a post within that specialty, they hopefully would be able to facilitate that. And that's certainly what I did. Once I'd done my SHO post, I then asked to do another registrar post in my core training, to see whether I, still found it as, the same at registrar level. The kind of application processes, I think, is similar to everything. They look at all kind of aspects of your CV. So, if you have a particular interest in teaching or whatever, then that's obviously a strength. And it used to be that people used to think that you could only get on the Oncology Grid if you kind of had a PhD, and it's not really like that anymore. They do recognise other attributes that are not just research. I mean, also research is quite a big part of oncology, but it's not kind of
be all and end all.
Yeah, and having a lab based or a kind of that kind of PhD isn't necessarily a requirement, but they obviously do look for sort of various things that might make you a little bit different, or certain things that you've done, that would be attributable to oncology as well.
And obviously commitment to specialty is a big thing.
Yeah.
So how can trainees maximise their chance of point scoring to just get that interview?
So I think, as far as I can kind of remember, on the scoring form, so if you can manage to get a presentation or a publication within the specialty, then that would, gets you certain points. You get points for teaching. There is a whole section about commitment to specialty, so all the different things you've done. But my advice would be to try and get something in kind of each area, so that you and maximise what you do, because a lot of things we do, you don't, you think, oh, that was only a small project, but actually, it's still worth putting down. It may have made a difference, and if you presented it locally within your department, then it's important. And as with all things, it's ideal if it's kind of followed up. So even if you've done a project and it's not then been re-audited, if you find out that someone else has re-audited it, then that's useful to put down as well.
So how can so actually you've answered the next question as well, in how we can improve our score on the application. What about leadership years? Have you done? I know you took a year out to do research. Is there any other advice from taking a year out that trainees could benefit from?
Yeah, so you could. I didn't do one of the leadership or management fellowships, but I do know some people that have, and I do think if it, it is a useful thing, and it does obviously help you score points on the form. I'm not sure I would necessarily do it just for that reason, but it's a personal
trainee
preference. Yeah, and I think it does give you. I think what those posts give you is an insight into kind of how the hospital runs, and sort of all the sort of management stuff that goes on behind the scenes, which you do learn once you become a consultant, but I think you're not so exposed to during training, because you just don't see it when you're on the wards all the time.
And you don't have the time sometimes. You just want to get through the days when it gets really busy.
Yeah. And then some people go, to, other centres and do like an out of programme experience in, either in a different country or in a different specific centre that's got, if you have a specific interest in a certain area of oncology or something, you might want to go and do an out of programme experience. But most people would do that, I think, once they'd already got onto the grid rather than beforehand.
And obviously, solid tumours is your thing in Cardiff.
Yeah.
How did you lead into solid tumours?
Well, I've always had an interest in sarcoma, so I have. I'm on one of the national research groups for that. And basically, I think obviously when you get a consultant job, you've got to try and find your place in that department, isn't it? And we're very lucky here in Cardiff that everyone's quite flexible, and we all kind of agree, that we are happy to, work and basically manage all tumour types really. But in terms of a research interest, sarcoma's always been the interest. It tends to be split between solid tumours and leukemias anyway. There's not many oncologists that sort of manage leukemia on a day-to-day basis. Obviously we do out of hours, but yeah, it's just I think that's just how I've developed the research interest really, and taken it from there.
And obviously I don't think you can really apply for a grid post in the specialty if you haven't done a proper job in it. So say if there's a trainee ST1, ST2 and they're thinking in the back of their minds, well, maybe I want to do oncology. You said about taster days. Is there anything else they can do to get that flavour of oncology?
Well, if someone's really interested at that early stage, then there's plenty of opportunities, hopefully, to work in the specialty, isn't it? So I would contact the training programme director and ask to be placed in the specialty, because most training programme directors, as far as I've, the experience here, is that they have been relatively accommodating.
Yeah,
and it may be that it may not be the exact 6 months that you want, but usually, you will be able to get a post. I know that some grid centres don't have SHOs working in oncology as a kind of day-to-day job, and so I guess for that, then you would end up doing it more kind of through tasters and through attending clinics and things like that. But I think, the most important thing would be to discuss it with the training programme director, and sort of ask them how best they can support you in that interest, because it's a relatively it's a specialty really, I think, that doesn't have, not everybody wants to do oncology.
No.
So you would, if someone does have an interest, then really, and it's the same with the other specialties, isn't it, that really they should try and support you in that.
And obviously I can imagine you are very approachable to work with, and you'd probably be more than happy to be contacted by trainees for advice.
Oh, absolutely.
Yeah.
And it's the same if someone's applying for the grid. Hopefully we would know them anyway if they were local to our centre. But of course, get advice, come and see us. We'll do our best to support any trainee in the department who has an interest. We do our best to support them, and of course look at the application and everything like that as well.
So moving on to the interview now.
Yeah.
I know you said earlier about the interview, you can't remember how long it was, and I think once you go do an interview, you lock it away in that side of your head because you just survived it. But what can trainees do to get ready for this interview if they are successful from their application?
So I can't remember exactly how long it was. It was somewhere around 40 minutes, I think. But basically, I would advise, speak to other people who've already had an interview, because they'll be able to advise you. Most of these interviews are quite structured and tend to be similar year to year. So in terms of the actual structure of the interview, you can get advice. I would practice, so find consultants or find people who are willing to give you a mock interview, and try to do it as if it is the real thing, which is always hard when you're being interviewed by people that you know very well. But the more you can practice, I think, and the more you can kind of hone the answers to the questions that are obvious, then that's helpful. And then there's lots of kind of advice online and books and things about the medical consultant interview. Not consultants, are we? But in terms of like interview techniques and things like that.
Is there any specific resources for oncology that you advise?
So it's within the pediatric oncology trainees group. There is facilities. So they have a kind of online page which has advice, and also they I think they even do a whole kind of day on preparation for interview and things like that. There's, as far as I'm aware, I don't know of any other kind of specific resources, but I think if someone really is interested, I would definitely recommend they join the Pediatric Oncology Trainees group, because they know all of the kind of up-to-date stuff, and they're all in contact with the CSAC, which are the people who run the Grid program, and so, you know, in terms of the structure of the interview, because it's pretty much always the same.
And obviously, when it comes to any interview, there's a structure to answer any question. Is there anything specific for oncology the trainees need to be aware of, or is it? Because I know when I spoke to other trainees with other specialities, they advised, you know, the the medical registrar book. Is there any other resources you can think of that would be beneficial
in terms of how to answer the question?
Yeah, or is it just the practice?
I think it's practice, but also I think trying to get some structure to your answers.
Yeah.
So if you are having if it's a clinical scenario, then obviously just try and go through it in a systematic way, in the same way that you would normally. You know, whether when you're calling a consultant for advice, or that, you know, you're thinking about the SBAR or something like that.
Yeah.
You know, just try and go through it in a systematic way, because then you're less likely to kind of forget things. Yeah, I don't know of any more kind of written resources. That doesn't mean there aren't any. It's just I'm not aware of any. But yeah, I think just my advice for the interview would be to practice clinical scenarios, and then, because the way you answer a clinical question is similar no matter what the scenario is, isn't it, to a certain extent. And then in terms of the answers to questions around why you want to do the post, what you think you can bring to the post, or, you know, this kind of thing, you can at least, even if you can't prepare the exact answer, and it's important not to do that, because they will word the question slightly differently, and you don't want to answer the wrong question, but you can think about things that you want to tell them about you, isn't it, and how you're going to bring that into each question, and sell yourself, and then just adapt it to whatever they ask you, because there'll be things that you will have done that you want them to know about, and you've got to fit it into that interview framework, and so you can sort of train yourself to think, well, you know, they've asked that, and I'm going to answer them, but I'm going to tell them about this as well,
because I want them to ask me about that next.
Or just, you know, so that you can make sure you've told them that you've done it, you know, so that, because there may not be another opportunity, but you do need to make sure you answer the question. Because what some people will do is go into an interview and they're so fixated on what they want to tell the people that they haven't necessarily listened to what they're being asked. So you do need to make sure that you answer the question, but there are sort of ways of getting in, you know, where you can use, so if they ask you about something, you can use an example of what you've done to illustrate the answer or something like that.
And do you remember what sort of questions tend to come up?
So definitely they will ask clinical scenarios, and they're relatively straightforward, but they will have an oncology, they will be oncology based, so they do expect some knowledge of oncology. So and you know, they may ask you about some side effects of chemotherapy, or, you know, how you would approach a new patient with, I don't know, an abdominal mass or something like that, and then so there's those, and there's usually, I think, at least two. I think there's two clinical scenarios. It was a long time ago since I did mine, but and then there was a critical appraisal of a research paper, which they usually give you on the day beforehand. So they don't give it to you in advance of the interview, but they give it to you on the day before the interview, so you get about half an hour to prepare or so. And so it's worth doing that practice, because, you know, there's quite a systematic way of appraising papers, and then how you present it back to people. Sometimes there's a presentation as well. So sometimes before the interview they will tell you, this is what you're going to be talking about, and you need to prepare a 10-minute presentation or something like that, or 5 minutes and 5 minutes for questions. And obviously if you do that, if they do that, then you can take advice from colleagues and things to help you prepare for that. And then they usually ask you questions, you know, about yourself, what you can bring to the role, or what, you know, those kind of questions, why you want oncology. That's the basic structure, I think. Obviously it changes slightly year to year, but that's certainly how it's been, and it's very similar then when you have the grid assessments. They are very similar to the interview.
And just to finish then, is there one top tip or one thing you wish someone would have told you when you were applying for Grid that you could pass on to trainees now?
I mean, I was very well supported from here, to be honest. Some of the consultants were very supportive of me and gave me lots of advice. But I think the most important thing is basically as soon as you think you might be interested, whether it's in oncology or any other grid specialty, let people know that, so that you can start, because even from very early on you can start doing small things that then kind of build your CV and work towards that, you gaining that grid specialty. So I think that's the most important thing, I think, is to prepare as early as possible, so that you've got time to build your CV, and also to find out if you really like it, because I think you never know until you actually work in a job, and it's difficult. It's different working at SHO level and middle grade level. And working at middle grade level in a grid specialty is much more similar to what it would be like as a consultant, I think. So yeah, I think that's the most important thing. I think just prepare early and use the resources that you have in your hospitals and let people know that you're interested, because most people really want people to be interested in their specialty, and therefore would be more than happy to support people who are interested through the process, because once you've done it, you can easily support other people, isn't it? So,
yeah. You want to feel like you've achieved something by bringing someone else into the job.
Well, yeah, and medicine's about succession planning, isn't it?
Yeah, exactly.
You want your department to grow, and you want the future of whatever your specialty is to develop and to get better, so that you deliver a better service for the children, isn't it? So,
definitely.
Yeah, I think that's what. So, and there's I think within paediatrics generally there is quite a good mentorship. Sort of experience, I guess, and that's certainly what I experienced. The consultants both in Bristol and Cardiff were very supportive and very, kind of took the time to make sure that you're developing the CV properly and doing all the things you need to do. So yeah, I think we're lucky in paediatrics for that.
Yeah, it's true. Well, thank you, Maddi. I'm sure people have found that very interesting. I know I found it very helpful and interesting after completing the last 6 months working in the department. So thanks for joining us. And I'm sure, I know from personal experience, the team in Cardiff are so supportive, so friendly, and if anyone does have an interest, they'd be more than happy to support and just advise.
Yes, of course, definitely, yeah.
And if there's any ST1s, ST2s who are thinking about oncology and not sure what specialty job to try for ST3, I can only recommend the oncology job. So thank you for listening.
And I just wanted to say thank you to both Dr Maddi Adams and to Celyn Kenny there for that podcast. That was really helpful. It's worth bearing in mind for any of you who are applying this year, or maybe even next year in 2021, that the effects of COVID might mean that the interview process is very different. So we strongly recommend heading to the Royal College's website for a more up-to-date guide as to exactly what stations will be and will not be present in your interview. Join us again next week. Thank you for listening to Dragon Bytes.